Welcome. Wednesday, March 6th, the Minnesota Senate Human Services Committee. We don't have a quorum yet, but Senator Frentz from wonderful metropolitan city of Mankato and North Mankato. Those are actually the Twin Cities, right? That's what you refer to the Twin Cities, wouldn't you, Senator?
I would. Thank you, Senator Hoffman, Mr. Chair, and members.
And we do have a quorum, just to let you know, so if there's any cool amendments that need to be added, you know, we can do that first thing. But in front of us, hold on, I need to go to school. I just got word, Senator Frentz, that there is an amendment that is going to be printed, and we'll just have to deal with it later. So you have that in front of you. We don't have that, so I guess we can take it up anywhere along the line. What do you think?
I'd be happy to wait a little bit if that makes it easier for staff, Mr. Chair.
Hold on. Thank you. Now let's just do this. It's Senator Frentz. Let's go ahead and you got Dan Porter, who's waiting on the Zoom land out there, and Heidi Nisler, and then Rob Arnold, and Lisa, I'm not even going to try to pronounce your last name. You're going to do it for me. It's Hoogheim, is that correct? Hoheim. All right. So, you know, not bad. 1 out of 4 is 25 per 20. I can't even do math here, Senator. Senator Frentz, Senate File 1028, Medical Assistance Coverage Modifications for Special Education School Social Work Services. Thank you for bringing this bill. It is absolutely consistent with my current understanding of anything that was established in 1975, otherwise known as Public Law 94-142. So if anybody wants to get in the weeds with me on that, I love that. I miss education. So Senator Frentz, go ahead.
Well, thank you very much, Mr. Chair and members. I certainly am not one to get into the weeds, but obviously Senate File 1028 deals with Section 256B.0625 Subdivision 26. I think we all know that. I'm here to ask for your support for a bill that Senator Hoffman, Senator Abler, and Senator Wicklund and I are bringing forward. The general term we use is third-party billing. But what we're trying to do is we're trying to help students and school districts, and we're trying to see that the provision of social work and the benefits that students and the people of Minnesota get from that are allowed to be billed to the federal government. This is a matter of between $7 and $10 million a year, and this is, I admit, Mr. Chair, the second biennium in which you and I have been on a bill seeking to do this. So members, this is not something that just developed here in the last few minutes. I am a proud parent of 4 children. 2 of them work in special education now. Across the state, we're seeing an increase in demand for the services that school social workers provide. We're seeing an increase in the needs of students to have those services provided. We're seeing an increase in the need for families. And what Senate File 1028 does is allowed for third-party billing and make some changes in the way that those social workers seek the billing and the documentation required therein. Mr. Chair, I do have the A2 amendment, and if I took your inkling earlier, I would like to move the A2 amendment at this time.
It's coming. Absolutely. Members, the A2 amendment is being handed out, and I wish you could move that, but since you're not a member of this committee, I think once it gets ruled out, we'll have Senator Mitchell make that move. Senator Mitchell, do you move the A2 amendment?
Yes, Chair Hoffman, I would like to move the A2 amendment, please.
Thank you. Members, the A2 amendment is coming. It's is it in front of people over there on the other side of the table? I have one. Do you got one? No, it's coming. It's coming, Senator Rasmussen. So, Senator Frentz, while it's handing out, do you know what we're trying to do here on the A2?
Yes, and I want to pay a special compliment to Mr. Ronahan. We had some amendment work done yesterday.
Yeah.
DHS provided us the A2 amendment as a version of the technical assistance, and I think after a discussion with Mr. Monahan, that's what I'd like to have this committee move onto the bill. It essentially provides the covered services language under medical assistance, and in my opinion, although you know, Mr. Chair, I'm not an expert, that's preferable to one of the other amendments that we drafted.
Thank you, Senator Frentz. Actually, members, as you're looking at that, to get technical assistance on the Department of Human Services, that was one of the things that was falling in front of us in the last couple of years was how does that look when you're providing services within the scope of practice, right? How do you get that service and the clinical trainees and the different scope of practice as well in that one too. But then it also delivering the children's therapeutic services, I would assume you're addressing in this as well. So any questions on the A2 amendment? No. Senator Mitchell renews her motion to move the A2 amendment. All those in favor say aye. Aye. Opposed, same sign. Senator Frentz, it is in the form that you want your bill to be had. So do you want to bring in Mr. Danny Porter first from?
I do, Mr. Chair, and thank you for that, and thank you, members, for adopting the A2. Mr. Porter's available on the line, I believe.
Mr. Porter, welcome to the committee. Nice to see you.
Hello. Hello. Yeah, I'm sorry I couldn't be there in person. So good afternoon, Honorable Chairman Hoffman and committee members. Thank you for your time. I'm honored to testify on behalf of the Minnesota School Social Work Association. My name is Dan Porter, and I am a school social worker on special assignment for Intermediate School District 916. I'm also the proud parent of 3 children who receive mental health services in the school district that we reside in Maplewood, Minnesota. Minnesota School Social Work Association appreciates you for including language related to federal Medicaid reimbursement for school social work services that are provided on IEP or IFSP, and increased funding for student support staff in schools. These efforts are crucial to provide the support that students and my children need. It is appreciated that the Senate has placed a priority on these provisions as they work to decrease the number of students who are under mental health distress, as identified in the last Minnesota student survey. One of the strategies to accomplish this is to ensure students access the mental health and behavioral services in schools. Research indicates that 18 to 20% of students have mental health issues significant enough to cause impairment to major life functions, yet only 1 in 5 receive the necessary services. Equally, the need for school mental health services has increased as schools are challenged to equitably fund these vital life services. Please also consider the equity of access, as all children are in schools. Not all parents are able to find mental health access to services after school. Schools provide an equitable link. Of foremost importance to the Minnesota School social workers is the language of SF 1028, which will provide reimbursement for all behavioral health services covered under the medical assistance state plan provided by school social workers through federal Medicaid for eligible students. Minnesota school social workers provide services to a significant number of students with disabilities that also require behavioral health services. Currently in Minnesota, the only way to access these federal Medicaid funds is through children's therapeutic and services and supports, which is otherwise known as CTSS benefit. CTSS requirements means that behavioral health services are required to meet separate billing requirements outside of the special education criteria and beyond what the Center for Medicaid Services require to access these federal Medicaid funds. CTSS is a Minnesota requirement. As a result, CTSS severely limits school districts' ability to seek federal funding for school social work services and requires schools to use cross-subsidy funding to pay for these services. All other health-related services, including speech language, occupational and physical therapy, and school nurse services, have been successfully billed federally by federal Medicaid funds in Minnesota. However, school social work services, which are included under the same Minnesota statute as health-related services, can't bill. Our current broken practice in Minnesota, known as CTSS, does not allow districts to bill these services the same way, and in fact adds additional equity barriers that no other related service provider needs to receive the same benefit. Fact, Minnesota school social workers are qualified and licensed mental health professionals and practitioners providing Medicaid eligible behavior and mental health services. School social workers go through the same education, training, certification, licensure requirements as mental health providers in the community. Many of them actually cross. So I do both in the community, and I'm also a school social worker. Other states have resolved this issue, and licensed school social workers in those states are being reimbursed for the services they perform. As a result, these states are receiving considerable federal dollars to support students with IEPs and IFSPs. Conservatively, as you have already talked about, Minnesota is losing potentially $7 to $10 million each year. Minnesota schools are failing to access federal Medicaid funds. Furthermore, schools are drawn down their educational funds to provide the services, which adds to increasing their cross subsidy. The current CTSS-DHS option has failed. The state is losing federal dollars due to an old and broken benefit. The goal of the school social work community remains clear. We believe that school social workers should be eligible for third-party reimbursement for mental health services they provide. We will continue to pursue this goal. As you can see by the additional letter of support and over 16 and growing additional educational advocacy organizations in favor and additional parent support, please ensure this moves forward. We are hopeful this step will lead to a resolution to ensure school social work services will be reimbursed. We understand it can be difficult to merge the medical and educational models related to federal Medicaid reimbursement. However, past legislation dictated discussions have accomplished nothing for several years without producing any progress necessary to allow school social workers to bill for services they already are providing. At this time, for a change to step up and to be in par with other states, nothing is being asked here that is out of line with other states or even considered to be innovative. Change needs to happen today. In closing, Minnesota School Social Worker Association urges you to support SF 1028 to ensure all school districts can access essential revenue and support all children. SF 1028 will allow to fund health-related services in schools by accessing Medicaid, the primary payer for special education. These provisions will help to increase health equity, provide comprehensive school-based health services, help to fund and support the governor's priorities, and will generate lost federal funds into the state. Thank you so much for your time and support of this critically important initiative.
Mr. Porter, thank you for your testimony. Next up, Heidi Nisler. Are you, come on down. You might as well, I think Rob Arnold is here too as well. You might as well come on down and sit on the other side. Heidi Nisler, that's a Litchfield name. Welcome to the Senate. For the record, state your name and you can start. So thanks.
Thank you, Chairperson Hoffman. My name is Heidi Nisler, and I'm the Director of Special Education for Eden Prairie Schools.
Welcome.
Thank you for the opportunity to speak with you today about Senate File 1028. I very much appreciate the opportunity to speak about this very important bill. As I shared, I am currently the Director of Special Education for Eden Prairie Schools. Prior to this position, I was a Director of Special Education for districts in Greater Minnesota, including Becker, Big Lake, Monticello, and St. Michael, Albertville. As a school leader, my top priority is to ensure that the needs of all students are met in our school system. One important area of skills instruction that we provide is behavioral health services from our school social workers. And this service is within the scope of practice of school social workers. These services are provided to students with disabilities who receive special education services, and these services are outlined on a student's IEP, Individualized Education Program. Without these supports from school social workers, many students in our schools, in our community, would not have access to any behavioral or mental health support. And these services are within the scope of practice of social workers in both the private medical settings, but also in the school setting. Many social workers have moved back and forth between school settings and medical settings and have shared that the services they provide are the same across both settings. From birth through age 21, school districts provide many educational services that are also considered medical services, and we are required by state statute to bill Medicaid for these services. Districts across the state currently provide and seek Medicaid reimbursement for physical therapy, occupational therapy, speech-language services, transportation, school nurse services, and more. Within the school setting, each of these services is simultaneously considered educationally necessary and medically necessary. However, school social work services have been considered to be different and have different requirements that go beyond what is required by Medicaid for reimbursement. These additional requirements for school social work services have placed such a huge burden on districts that most districts across the state have been unable to bill for these services. In addition to our responsibility to provide all services necessary to ensure each child is receiving all of their needs met, school districts also have an obligation to our communities to be fiscal stewards of the tax money that we receive to fund our schools. The current requirements to bill for social work services have resulted in millions of dollars being left in Washington. This is millions of dollars that were set aside for the specific purpose, but schools have been unable to access this funding. Accessing these additional funds would come at no cost to our local communities or taxpayers across the state. Our ask is for school social work services to be in alignment with all other medical services that schools are currently providing. These services are already within the scope of practice of our licensed professionals, and the funding is available at no additional cost. The current requirements are not only negatively impacting districts, this is impacting students. Thank you.
Thank you, Ms. Nisler. And thank you. I forgot to say that to Mr. Porter, too. Thank you for your service to school districts. As you were you're talking about that, there was a letter in 2022 about school-based services and how CMS made the differentiation between what is Medicaid. And I see Mr. Arnold is shaking his head. So with that, Mr. Arnold, welcome to the committee.
Mr. Chair, committee members, thank you. Good afternoon. My name is Rob Arnold. I'm the Assistant Administrator for Medicaid reimbursement in St. Paul Public Schools. I'm a licensed speech-language pathologist and a proud parent of 2 young adults who have both received mental health supports through the schools. And I'm here to support Senate Bill 1028. I've been in my current role for about 1.5 years and have quickly learned that St. Paul Schools alone is missing out on an estimated $4 to $5 million annually in reimbursement for special education mental health services. The statewide estimate is over $20 million when you include all of the disability areas in special education. The reason is that the CTSS benefit requires school social workers to complete a diagnostic formulation and give a mental health diagnosis to a child as part of their special education evaluation. However, these requirements for reimbursement are not part of special ed law and are actively discouraged by the Center for Medicaid Services. According to CMS, states can determine that some services are medically necessary for children and youth without a diagnosed behavioral health condition. The CTSS benefit has changed slightly over the years thanks to the work of many individuals and committee recommendations. Still, only 6 school districts utilize this benefit because the requirements at the heart of CTSS have not changed. Therefore, schools must use 100% of their educational funds to pay for services, rather than seeking available federal dollars. As a colleague of mine remarked, CTSS is a meaningless benefit. To close, I'd like to add that modifying or eliminating the CTSS benefit will not change the services students receive in the schools. School social workers across Minnesota provide high-quality, medically necessary mental health services to students right now. This bill will begin to allow school districts to access available federal funds for reimbursement. Thank you.
Thank you, Mr. Arnold. And you know, the other thing that letter, when you look at that, it was also talking about, you know, under EPSDT screening. And it just, I like to see this because Centers for Medicaid Services made it very clear about the whole child. And this bill makes sense. And with that, I know that the school psychologists are now happy the A2 amendment was there. So it's nice to see that there's folks that are starting to say this is good stuff. So thank you for your work and what you're doing, and I appreciate you coming here for that. So Ms. Hoheim, Lisa, I'm still getting it wrong, aren't I? Hoheim. Thank you. Please accept my apology for, not getting the name. But I guess I'm
one
not the
gets
only
it right.
chair
It's okay.
who does that. So I appreciate you being here. Please, for the record, state your name and then let us know what you know.
My name is Lisa Hoheim, and I am a parent. I am a proud parent of 2 boys that have mental health challenges. I'd like to start by saying good afternoon, Honorable Chair, Senator Hoffman, and members of the committee. I'm testifying in support of the Senate File 1028, which would increase access to and reimbursement for behavioral health services provided by licensed school social workers for Minnesota students. My oldest son is on the autism spectrum. He's been diagnosed with bipolar II disorder and attention deficit hyperactivity disorder. He lives with a baseline of suicidal ideation. When triggered, he becomes extremely dysregulated. He becomes agitated, punches holes in walls, and bangs his head. My son first verbalized his suicidal thoughts when he was in elementary school and threatened to throw himself over the 3rd-floor balcony with the intent to harm himself. Unfortunately, my son did not have a mental health diagnosis and hadn't yet qualified for special education, so there was not the option to receive services from the social worker. I alone had to navigate the very complicated and very broken mental health system of care for children and families. Several inpatient and partial hospitalizations later, time in the juvenile detention center, and 3 different school placements, the school social worker remains a very valued member of my son's treatment team. Through a comprehensive special education evaluation process, my son qualified for mental health and behavioral health services, and his resulting IEP was developed to ensure access to highly qualified school social workers to meet his needs. She knows what triggers my son's. She knows the behavioral antecedents to his actions. She knows how to intervene in a safe yet unintrusive manner to assist my son to become regulated so that he can learn. She coordinates with his mental health therapist, his med provider, and his county case management using a systems approach to whole child wellness. My son recently turned 18. This was a birthday I feared we might never see. My son is now thriving. He's attending the Finishing Trades Institute and will be starting transition programming very soon. The school social worker was instrumental in recommending this program for my son, in guiding me to obtain additional mental health services for my son, and in assisting us to put together a transition plan for him to work independently on independent living skills. Unfortunately, the children's mental health system does not transfer to the adult mental health system. All the work I've done to get services for my child will no longer serve him because he is 18. The school social worker most recently assisted me in finding information on guardianship, Social Security disability, housing, and adult case management. She's been my guiding light in getting everything in place so that my son can not only graduate but live independently. My youngest son also struggles with anxiety and attention deficit disorder. He tends to internalize his feelings and not externalize. While he does not exhibit behavioral concerns and performs well in school, he does not qualify for social work services because he is not in special education. I alone am tasked with finding outside services for him without the guidance of a school social worker. We are doing a disservice to children who experience mental health challenges if they cannot access the expertise of a school social worker because they're not in special education. 2 very different children, 2 very different experiences. Every child deserves to attend a school that is safe and supportive. This means that they need a trusted adult to connect to, someone who has education, training, knowledge, and skills to appropriately intervene, and that is the school social worker. Please show your support by removing barriers for districts to access federal Medicaid dollars to support these vital services provided by school social workers, as they are professionals and practitioners. Our Minnesota students' lives depend on it. Thank you.
Thank you so much for your testimony, and thank you for, I mean, we know, we as parents are our child's biggest advocate, right? And that even continues. It saddens me to hear of the transition is non-existent, right? And from the early childhood or child to the adult world. And the other thing it saddens me is here's a, it's an obligation of a school district to identify, assess, and evaluate every child with a disability, period. I mean, that's been my current understanding of federal law since the very beginning. And it's like, what's missing in that, right? I mean, there's a piece missing. I'm glad that, as I was talking about the letter that CMS sent to states, and Mr. Arnold probably read the letter because he was shaking his head, there's a provision in there specifically about 504, right? Under the Rehab Act of 1973, it says you can't discriminate based upon that characteristic, which is a disability, right? It's kind of the great equalizer. And it still befuddles me that we are having this same conversation. I mean, and I know there's a certain senator on this table that, gives me a hard time about talking about the 3 C's of Part C, and I won't mention his name, but he's from Anoka. But seriously, Jim, here we are 30 years, 40 years later, we're still having these conversations, and it just absolutely just befuddles me. And it's like, where can we help fix that transition period on the adult side of mental health? And I think, Senator Wickland, if you got any great ideas in your committee on that, I'm all in. I mean, it's just, it just still is a mystery. But I appreciate you telling your story, and thank you for hanging in there. I love this bill. I absolutely love this bill. And so, members, any questions for our folks? Senator Mitchell.
Thank you, Mr. Chair. Thank you for your testimony today. I'm a foster parent, so I have a child with an IEP, and I can't imagine going through some of the wickets that you already have to go through to get support without the fact that I have like a support team and what I need. I guess my question, if I understand everything correctly, is yes, often parents are the best advocates, but sometimes they are not. And if a child self-identified with these new parameters and they weren't getting that sort of support at home, would they then also be able to put themselves in for services, so to speak, at school?
Here comes Dr. Nisler. That is a Litchfield name, by the way, isn't it?
I am indeed from central Minnesota.
Thank you very much. Go ahead, Miss
Yeah.
Nisler. Thank you.
So this bill would only apply to services at this point that would be covered by a student's IEP, Individualized Education Program. And up through age 17, the parents are the ones who consent to that document. A student would only be able to sign off on their own services once they turn 18. So any child up through age 17 would require parental consent for any or all services. If a student were to self-report potential needs to a staff member, that would always be brought back to parents before any changes in service were even proposed.
So,
Senator Mitchell.
Thank you. So if I'm understanding correctly, the parent that didn't have an IEP yet still would not be covered, because you have to go through a list of things to get that. And again, I'm very supportive. I think this is great. I'm just trying to understand what this is expanding, and if we're expanding it enough to cover all the situations. So you would have to have an IEP under this?
Ms. Nisler.
The additional funding would be for students with IEPs, but if we can cover those services and get funding for those services, that would release other district funds that are currently being used, and those funds that would become available to expand services to students beyond those who are already receiving services that could be reimbursed by Medicaid.
Senator Mitchell, follow-up.
So is there any guarantee that the districts would actually release those funds and let other kids into the program if this becomes available?
Ms. Nisler.
Mr. Chair, Senator Mitchell, maybe I could tackle that one.
Senator Frentz.
So what we're talking about here is services that the federal government says Minnesota can be reimbursed for. So to your question, what we're trying to do is free up resources within these districts. And I guess you're saying, well, what would those districts do with that? I would hope they would apply it to the needs of these students. But if your question is there a specific requirement in the bill? No, we're simply saying CMS already says you can get this money. Other states are already receiving this money.
Yep.
And this simply identifies the services in the final section, so that there's no longer any question, A, what services are covered, and B, what it takes to submit the billing properly. It's really a bill that says, we're providing these services already to these children.
Yep.
We simply want to have the federal government reimburse us, and suggesting a better path to see those reimbursements be made. Each of the districts would then have those resources, hopefully for the good of the students.
Senator Frentz, you should be on education.
Thanks, Senator Hoffman, I think.
No, it's good. Senator Mitchell, does that
That does answer my question. I would just like to state for the record, again, completely support this, that I would hope that that's what happens then when we have more money freed up, is that the money does actually stay in expanding mental health services to more children, and that the freeing up of money just doesn't mean the money kind of ends up somewhere else.
Yeah, and to that point, Senator Mitchell, I'm glad you bring that up, because there's the provision, like 2005, a certain school district, I'll say it's probably the largest school district in the state of Minnesota. I don't know if anybody wants to guess what one that is. Prior to them really realizing what third-party billing is about, right? They were maybe accessing $5,000 to $10,000 in reimbursements for medically related services, speech, your ASHA people, OTs, PTs, occupational therapists, right? And the fact is that they were looking at nursing. If you had a licensed registered nurse, licensed school nurse, you could bill at 68% versus just an RN at 44%. And so it was like, it makes sense here. And when they started to really implement it, I don't want to speak on behalf of them, but I remember when they were north of $3 million in getting reimbursement back for the services they were already providing, which is totally allowable, under the auspices of the Individuals with Disability Education Act and in compliance with what third-party billing is. And in Minnesota, I think that statute is 125.812. No, 821 is what it is. So not that, right? I mean, it's there. But this is really an important piece, because we're providing those services. And here's what you'll get with this, Senator Mitchell, is right now the district is, and I'm not going to use that word, but the district is paying for a social worker to do the social worker job, but they're not getting reimbursement, so they're pulling this money from some other kind of fund. This way they're going to be able to reimburse that, which should free up that money to go someplace else, in the sense of maybe they could add more social workers, maybe they add the needs, Again, adhering to 94-142 said the unique and individualized needs of the child and disability and how it affects their education. Not that I would quote federal law, but I just did. So, Senator Frentz, any other questions for our senator? Senator Utke.
Thank you, Mr. Chair. And I've been hearing from a couple different, or a couple of you talking about the schools, and I guess my question would be, is there anything new that the schools need to do, or are there any more requirements put on them? It sounds like they've got the ability to collect these federal dollars, but is there anything different that they need to do other than request the money? Or is there going to be additional staff, or, just, we always hear the word mandate. I haven't heard that come up yet, but. Yeah, I know, and I'm trying to find out, just the schools, are all our schools capable of doing it now? And, would there be anything additional required for them to participate?
No, that's a great question, Senator Utke. And Ms. Nisler, you want to respond to Senator Utke on that one? I mean, or Danny Porter's online too, but they're already doing it, right? This would just be them filling out. Ms. Nisler, you want to talk about what you need to fill out?
Yeah, upon a review of this bill, there are no additional mandates that would be placed upon schools to make the process even more difficult. This would only allow easier access to the federal funding through Medicaid, reducing some of the barriers for districts to access those funds. There's no additional burdens or requirements.
Senator Utke.
Thank you, Mr. Chair. And along what you just answered there, is it everything from our smallest school districts to our largest that deal directly with the federal government?
Yes.
Okay, so it's just a clean, transparent process.
Yeah.
Nisler.
And that's part of why I referenced when I was doing my introduction that I've worked in outstate districts. When I worked as the director for Becker Public Schools that served 3,000 students, we had several social workers at each of our buildings. We had 2 elementaries, a middle school and a high school, and we had school social workers. We might have only had 4 social workers as opposed to a St. Paul Public Schools that may have hundreds, but receiving funding to offset the cost of those 4 social workers, we may have been able to add a 5th or a 6th to expand those services. So this could positively impact districts across the state of all sizes.
Senator Utke.
Just one more follow-up. Even with what you were talking about, those are large schools compared to my neck of the woods. I'm talking about school districts with a few hundred students. They would still have, within their current capacities, the ability to participate and do everything, as you say, right?
Yes.
Ms. Nessler.
Yes, I grew up in a very small community, Atwater, Cosmos Grove City. My nephews go to that same district now, and across the district, they have 1 or 2 social workers. And so many outstate districts that are smaller, this would either help them sustain those services if they're looking at budget cuts, or it may make it manageable to provide these services for the first time if they're able to offset the cost.
Thank you, Senator Utke. Good questions. Anybody else? I think, Senator Frentz, this gets to education finance is the next stop, right?
Yes, Mr. Chair.
I love it. So, Senator Mitchell, would you like to move that Senate File 1028 as amended be re-referred to education finance?
Yes, Chair, I move that File 1028 as amended moves to Education Finance.
Thank you. All those in favor say aye. Aye. Opposed, same sign. Senator Frentz, thank you.
Thank you again, Mr. Chair.
Nice
Thank you,
bill.
members.
Thank you for bringing this. Goodbye. I am going to, is Senator Pappas here yet? No? We're good. Let's go. Lisa Timian, you want to, should we go do our,
Time for a revolution. Senator Hoffman, welcome to the table.
And
You've got
you
3
was-
amazing bills,
thank you, Senator.
and they're each very important. However, if you get to the point, you'll get to the other bills timely.
So thank you, Mr. Chair and members, and I have in front of you, actually, I have Lindsay Kruger and team from the Department of Health, and we promise to be really quick on these, right? That's the word of the day, but you're going to have Senate File 2411. Mr. Chair and members, really, it's a nursing home moratorium process change. There was a House author's amendment to align with Department of Human Services technical assistance. And so attached, you would probably find, I believe, the A2 folks. Do you have that in front of you?
Senator Hoffman moves the A2. Do you want to describe it, or just say just don't say it's to make it like how the House wants it, please?
No, these changes, Mr. Senator Chair, are technical and result from the statutory changes that the Minnesota Department of Human Services made in its property reimbursement system back in 2019.
Perfect. Any questions? All in favor, say aye.
Aye.
Aye. Opposed?
Thank you.
There you go.
Mr. Chair and members, Lindsay Kruger is here from the department.
Ms. Kruger, welcome to the
Yeah, I was going. Thank you. Go ahead.
No.
committee. Oh, yeah, Mr. Kruger,
Senator-
welcome, yeah.
Committee members, my name is Rick Michaels, and I'm the State Operations Manager with the Health Regulation Division of the Minnesota Department of Health. Just a quick comment on Senate File 2411. These changes are needed to create consistency between statutes concerning the Department of Health and the Department of Human Services. And my colleague from the Department of Human Services at the table here might be able to provide more detail on that.
All right. And hopefully something persuasive, so. Welcome to the committee.
Thank you, Mr. Chair, members. My name is Kim Brenny. I'm with the Minnesota Department of Human Services. I work in the Nursing Facility Rates and Policy Division. I'm the auditor of the Nursing Home Audit Program. The changes of the bill before you are technical in nature only, and they are needed to conform with statutory changes made to the nursing facility property reimbursement system that was enacted by the legislature in 2019. The changes in this bill are not intended to change the process, despite how it was labeled. State costs, provider reimbursement, eligibility, anything of that nature. It's simply to align some tail pieces in 144A that were missed being changed when 256R was changed to adopt the fair rental value property rate system for moratorium exception proposal projects that were approved by the Minnesota Department of Health after March 1st of 2020.
That sounds pretty good. So has anybody been affected by this, or have you just done workarounds and now you're going to make it all kosher?
No one has been affected by this program because there were not any moratorium exception proposals approved during that several-month window of time. So there will be no impact, and there has been no impact to any providers.
Any questions about Senator Hoffman's no-impact bill? I have a question. On line 1.8, I'm just curious, just in the old law, it says the Commissioner of Health in coordination with the Commissioner of Human Services shall deny each request for, and it goes on. So what would a coordinated effort to deny look like? Maybe that's just a question you can go and think about. It's just funny the way that that's a Liam Monahan at parties kind of a question. And so they could collaborate to deny. So couldn't they just deny on their own? But anyway, any questions about the bill? Senator Hoffman?
Thank you, Mr. Chair. I think this is, this bill, I think we want to go to the floor, correct? Is that what we're doing? Are we going to the floor on this one, council?
Seriously? Okay. All right, Senator Hoffman moves that Senate File 2411 as amended be recommended to pass and be referred to the floor. This is going to be a scintillating floor discussion, Senator Hoffman.
Thank you, Mr. Chair. I appreciate that, members.
All in favor, say aye.
Aye.
Aye. Opposed?
Same sign. Senate.
What's that? Oh, not right now. Okay, Senator Hoffman, you want to do which one do you want to do next?
Senate File 2413, Mr. Chair and members. There's an A1 amendment on that. This is the Home Care Survey and Assisted Living Licensure Survey Alignment.
And just technical, we're working on closed captioning. Oh, it's on now. That was quick. Thank you.
Is it working? Should be an A1 amendment in front of you, correct?
Senator Hoffman moves to A1. What does it do, Senator Hoffman?
This would update the home care licensure language regarding follow-up survey re-inspections and conducting exit conference to be consistent with the same concepts that are within the assisted living licensure, Mr. Chair. And what that does is eliminating these prescriptive requirements will benefit home care providers and the folks they serve by expediting the survey process, which will allow providers more time to focus on individualized client care rather than administrative survey processes that provide little or no direct benefit to the clients.
Okay. And you have a testifier.
I do.
Thank you.
Good afternoon, Mr. Chair. My name is Daphne Ponds, P-O-N-D-S. I'm with the Health Regulation Division of the Minnesota Department of Health, and I serve as the Interim Executive Operations Manager with our home care program. And I'm just here and available to answer any questions you may have. Thank you.
Well, thank you. Are there any members of the members here or the public have questions about this? Seriously? I'm sorry. Okay, well, come on down and give us your question, but if you can stick to the topic about this, so it is appropriate to ask for public testimony, but if you can just stick to the intent of the bill, that would be great.
Thank you, Committee Chair, people on the Senate Health Services Committee today. My name is Rick Heller. I'm the official representative, twice exceptional print disabled. One thing I just want to mention about the bill, when we think about third parties using state dollars, do they apply the digital accessibility laws to their content? It's related to those that help provide those services. However, if the legislature wants to do it in October 2024, you may consider the third parties working toward conformance on that. Thank you again for this opportunity to speak.
Thank you,
All
Mr.
right.
Heller.
I think that's enlightening. Any other comments? Without that, Senator Hoffman renews or start his motion with 2413 be recommended to pass and as amended and be sent to the floor.
Correct.
Is that right?
That is correct, Mr.
Do you
Chair.
understand the motion? All in favor, say aye.
Aye.
Opposed?
Same sign. Thank you,
On
Mr.
its way,
Chair.
Senator Hoffman.
There is now Senate File 2414. There is not an amendment, I believe.
Just a second. I might have screwed up something.
Screwed up. Don't you miss? Where's Fate? You know, it's like, you know.
Senator Hoffman, did we vote on the A1?
No, we did not vote on the A1.
Senator Hoffman, next time get a better person to run your meeting. So Senator Hoffman moves that we reconsider the vote by which Senate File 2413 was taken. All those in favor say aye.
Aye.
Aye. All in favor of the A1, please say aye.
Aye.
Senator Hoffman renews his motion that Senate File 2014 as properly amended be recommended to pass and be sent to the floor. All in
Senate
favor?
2413.
2413.
Thank you.
As
So,
amended.
As amended,
Properly.
sent to the floor. Thank you.
All in favor say aye.
Aye.
Opposed?
Thank you, Mr. Chair.
That'll affect my per diem, Senator Hoffman. Senator Hoffman to the 2414, another bill of amazing proportions.
Thank you, Mr. Chair. There was once an A9. That is no longer on the table, correct? And I think what we have is a very straightforward housekeeping change. Clarifies that nursing facilities can be owned by one or multiple owners. Updates one section that was recently passed, nursing home change of ownership statutes to align with proposed assisted living licensure, exact same language and implementation efforts. It creates less confusion for facilities with same requirements for the change of ownership, and it ensures our residents and families understand who owns that facility. Mr. Chair.
And thank you, Mr. Senator Hoffman. I want to know who owns the facility, and this bill will solve that concern.
Isn't that
Did you
correct?
testify or want to say the same thing? Go ahead.
Yes, my name is Rick Michaels from the Health Regulation Division of the Minnesota Department of Health. Yes, this bill would clarify that the requirements for a change of ownership and that multiple owners or an individual owner may trigger a change of ownership, and then so we can document that via the application and review process.
Well, thank you. Any questions about proper documentation of ownership changes? Seeing none, Senator Hoffman renews his motion that Senate File 2414 be recommended to pass. Do you want to go to the consent calendar? And be sent to the floor.
Yes, that is correct. Senate File 2414. Yes, sir, Mr. Senator. Yeah.
Any other questions about that? I can see everybody's on the edge of their chairs, Mr. Chair. So all in favor say aye.
Aye.
Opposed?
I don't see Senator Pappas, so Senator Mayquay, do you want to go ahead because we had told Senator Pappas 4 o'clock, but, you know, I suppose I don't see her, so what do you think? Ready? I like turn, there's like, Fate, where are you? So that was funny. Thank you, Senator Abler. No, thank you for doing that. This is a DHS early bill. Senator Mayquay, you are going to talk about policies governing access to substance use disorder treatment services modifications.
Yes, Mr. Chair, and before I get into it, I'd like to get my bill in the order I'd like it. I'd like to offer the A1 amendment.
A1 amendment is being handed out as we speak. Do you want to give us a little overview of what you're doing? And
Yes, this incredibly complicated amendment goes to page 33 and deletes subdivision 2.
I love it.
Which would change if not done, this bill from a policy bill to not a policy bill.
Members, go to page 33, huh? Well, that's funny. Any questions? Members, got it in front of you? All those in favor of the A1 amendment, say aye.
Aye.
Post same sign. Thank you. Now that this bill is in the form and the shape and the structure that Senator May-Quade wants, the table is yours.
Thank you, Mr. Chair, members. This is an agency bill that includes a provision in Section 20 that makes a clarification to an existing grant program that was passed in 2021 called the Home and Community-Based Workforce Development Grant, HCBS. The purpose of this grant is to help retain and direct support professionals who provide supportive services to people with disabilities and older adults. There is a legislative report and informational video in your packets and posted on the committee page with more information about the grant if you are curious. But funding for the Workforce Development Grant will be used to provide payments to direct support professionals. And to be eligible, workers must have incomes at 300% of the federal poverty guideline or below. Since funds are focused on low-income workers, the bill language excludes the payments from being counted as income for the purposes of public assistance programs like medical assistance. And DHS is awaiting the passage of this provision before distributing funds to direct support professionals and unintentionally causing a disruption to their health coverage or public assistance benefits. And so we have Christy Graham here who can answer more questions, but that is what the bill does, Mr. Chair.
So, members in front of you, and Ms. Graham, if you could kind of educate us about the Rule 25 is no longer in existence. Probably a lot of people on this committee don't know what a Rule 25 is, but you really address the comprehensive assessment in here, and I think, if that's something that you want to address on, I would be more than happy to help educate us about what you're doing. So, thank you.
Sure, Mr. Chair, members, Christy Graham with the Department of Human Services. So, thank you to Representative May-Quade for carrying another, what's that?
Excuse me, can I just say one thing?
Senator. Oh, sorry,
You,
it's still getting
unbelievable, you just got demoted.
Or promoted,
Or
Mr. Chair.
oh,
I don't
that's
know.
right.
And I'm Team Senate, so it's.
And you are Team
May-Quade.
Senate, that's funny. I like that. So go ahead, keep going.
Thank you, Senator May-Quade, for carrying this policy bill for us. So yes, it does include the Home and Community-Based Services Workforce Development Grant, which we just heard. Mr. Chair, you presented that the other evening in Chair Wickland's committee, which also has jurisdiction over that portion, as does this committee. And then the other portions in the bill are related to our direct access reform. So this is the reform, it's related to accessing substance use disorder services. The reform really dates back to probably the mid-2000s, 2006 or so, when an Office of Legislative Auditor report told DHS that we needed to take a look at how we were requiring people on Medicaid medical assistance fee-for-service to access treatment, and that they would have to go through a lead agency placing authority before actually being able to get access to treatment, and then that placing authority would say, here's where you should go to treatment. Subsequent to that, there were many work groups looking at how this practice actually creates a bottleneck and makes it more difficult for people to access substance use disorder treatment. And so over the years, we worked with stakeholders and we came up with what's known as direct access. And so now instead of getting a Rule 25 at a county or a tribe, people will get a comprehensive assessment. And then there's a few other changes with this reform, but it was fully implemented as of last July. CMS, in fact, indicated to us that they no longer wanted to renew one of the waivers that we had in place that limited a person's choice of provider, and that we had that in order to do this direct access process. So we no longer have that waiver. We no longer in practice do direct access. So the majority of this bill is really updating cross-references and getting rid of references to rules that are either have been repealed or will be repealed.
Thank you. Members, any questions? Thank you for, it's like I look at this and I just envision, you go into somebody's kitchen and you start to line up the beans and the corn, and this is another way of lining that up in the substance use. I appreciate you doing this, so Senator Mayquade, any final thoughts?
No, Mr. Chair, I appreciate Ms. Grum's support and trusting me to shepherd this bill through, and I look forward to the committee's support.
So where are you taking this?
I believe it, the floor? The floor, Mr. Chair.
Imagine that, Senator Abler. 4 bills going to the floor. So Senator Mayquade moves that Senate File 1692 as amended be re-referred to general orders. Is that correct?
That's correct, Mr. Chair.
All those in favor say aye.
Aye.
Opposed, same sign. Congratulations. It's on its way. Nice job. We have an hour presentation before we get Senator Pappas up here because, only an hour. Come on up, Sandy. This is nice to see you. Let's schwitz about Friday, how long I had to wait for, but simple, right? It's like, I'm glad you could get down here because we got you at 4 o'clock. So thank you for being here, perfect. Senator Pappas. And you have some folks, Teresa Bates, Diana Testad, Toby Pearson, Aaron Huppert. We got a whole bunch of people talking today, but Senate File 1621, you have an A9 amendment, is that correct?
I do, Mr. Chairman, but can I make some opening comments?
You can sure make your opening comments, and then we'll pull up your A9 amendment after that, so it's all yours.
Mr. Chairman and members, we all want the best care for the Minnesotans living in nursing homes in our state. Yeah, well, I'm sure we've all heard about the workforce crisis in nursing homes since the start of the pandemic. The truth is that we aren't going to be able to solve that crisis and give our nursing home residents the care they deserve until we address the crisis of compensation for the frontline essential workers who keep nursing homes running. That's why I'm bringing this bill to create a nursing home workforce standards board before you today. This is an old idea dating back to the Great Depression that's getting new life around the country as a way of bringing workers and employers in a given industry together with their regulators to level the playing field and improve wages and working conditions in those ways that will most support the needs of the workers who are caring for our loved ones. And in the case of nursing homes, that means stabilizing and growing the workforce to meet the needs of the employers, improving resident care, and doing so in a way that supports the state's goals of a world-class care for an industry that receives 80% of its funding from the state. So what this bill would do is create a 9-member board appointed to staggered terms by the governor as required for a rulemaking body. Those members would include 3 employer representatives, 3 worker representatives, along with the commissioners of the Departments of Health, charged with regulating nursing homes, Human Services, who fund nursing homes, and Labor and Industry, who address labor standards. The Nursing Home Workforce Standards Board would be charged with investigating market conditions, including through direct engagement of workers and employers, in order to set minimum standards for wages and working conditions through rulemaking, which are reasonably necessary and appropriate to protect the health and welfare of nursing home workers. The labor standards established by the board would be enforced through the Department of Labor and Industry's existing authority and a private cause of action modeled directly on that already in place in the state's Fair Labor Standards Act. And those standards would need to be reviewed by the board at least once every 2 years. To be clear, the authority of the board is limited to those conditions that affect workers and do not extend to standards for resident care. To ensure that workers are aware of the board's process and how to participate, as well as the standards set by the board and their rights, duties, and obligations under the new law, the Nursing Home Workforce Standards Board will be required to create a training curriculum to be delivered by worker organizations certified by the board. In trainings, and employers will need to provide a notice developed by the board to their employees in whatever manner they already use to provide other work-related notices. Finally, my bill ensures that workers are protected from retaliation for exercising their rights under this bill, including participating in board proceedings and trainings. Just to sum up, we all know how critical this industry is to hundreds of thousands of Minnesotans, and we also know that this industry is struggling. We have an obligation to provide for the care of our seniors, but unless we address the crisis of wages and working conditions in our nursing homes, we will never have the workforce needed to provide that care. Creating a Nursing Home Workforce Standards Board is a proven way to address that crisis and give these essential workers who have spent the last 2 years, we've spent the last 2 years praising, give them a voice in helping determine those minimum standards in partnership with employers and the state. And back to your issue, Mr. Chairman, I do have the A9 amendment, which has been suggested by Department of Human Services? Department of Human Services.
Senator Abler.
Well, thanks. I'll move the bill and then the A9 amendment.
So Senator Abler moves the bill and the A9 amendment. Folks, are you looking at the A9 amendment?
And Mr. Chairman, I can explain the amendment.
That'd be a good idea.
Absolutely. Senator Pappas, go ahead. We got some folks saying please, so yes.
Oh, you all have the A9 amendment. Okay. So this amendment can be divided into two pieces, with the first being technical changes that help bring additional clarity or help to meet some of the concerns raised by the long-term care imperative. And the rest of the amendment adds provisions that put guardrails on the cost of any new standard without a legislative appropriation, which I think is basically why we're here before this committee. So for the non-financial components on the amendment, line 1 through 2 through 1 through 7, help clarify exactly which employers and workers are covered by this bill. That's excluding administrative staff, medical directors, et cetera. Lines 1 through 8 through 1 through 11 require procedures that protect against anti-competitive behavior by board members. Lines 1 through 12 and 113, 125 and 126, 3.3 and 3.5 through 3.8 remove working hours from the board's standard setting authority. So that's no longer going to be part of their authority to determine working hours. While lines 1 through 21 through 1 through 24 would prevent standards that vary by region. And line 3.4, moving to 3.4, would reduce the frequency of trainings from twice annually to once every 2 years. So instead of twice a year, it's once every 2 years. Now, the remainder of the amendment creates a process for determining the cost of any new standards and requires that cost exceeding the forecast must be appropriated by the legislature in order for the standards to take effect. It does this by comparing the employee wage and benefits portion of the actual VBR rate for the coming year with the forecasted rates for employee wages and benefits a year later. If the standard costs less than that increase, it will go into effect without additional funding. If it exceeds that increase, it either needs to wait for a legislative appropriation to go into effect, or the board can roll back the proposed standards to come within the allowable increase. So trying to keep it within the budget. Just a few more key points. While the values-based reimbursement process does have a 15-month lag between when costs are reported and when these costs are reflected in the new rate, this bill and this amendment are not intended to address that. The bill as introduced would simply require any new costs work their way through the VBR rate-setting process, just like all wage or other cost increases that happen routinely outside of this new board process. This amendment was requested by DHS as a check on the board to ensure that decisions by the board can't push up rates beyond the equivalent forecast costs 1 year out without legislative action. But it also has the advantage to nursing homes of ensuring that any costs beyond that threshold are front-loaded in advance of those costs being incorporated into the VBR process. And Mr. Chairman, I have no idea what I just said. But it made perfect sense to me.
VBR, I was looking down the line to see, I was like, okay, shaking heads, really going, okay, we're there with you. We agree with the VBR. It's like, okay, why did that system get set up years ago? And AI, it's like, good, you did fine. I mean,
and I have
senators,
2 testifiers.
Yeah, I got a couple of folks that want to talk. And here's the thing, I'm really happy to hear that you have an open door policy about trying to get a win-win out of this, Senator Pappas, and then you're like, folks are working together, they're meeting, they're actually, there's some discussion, and I'm happy to hear that.
Thank you. To be honest, Mr. Chairman, most of that's going on in the other body, but I'm happy that they've taken some responsibility to continue negotiations.
Well, then we will, now, that's twice today, we've made reference to the other body. First of all, referring to the good Senator Mayquade as a representative, and then, of course, the, now the other body. So Senator Abler.
Oh, and just, Mr. Chair, Senator Pappas, who is the author over there?
Senator Pappas?
I'm sorry, what?
Who is the other body author? Do you know offhand? Doesn't matter.
I can't remember. I know that Representative Noor has been convening discussions with the stakeholders, but I actually, is it Representative Hewitt? Oh, Abaji.
All right.
Representative Abaji.
Yeah.
Mr. Chair, the reason I ask is that
Senator
Senator Pappas, on behalf of this body that you and I proudly serve in, I'm happy to work with you to help this body have its own opinions too. So thank you.
All right, thank you.
I'd take advantage of that one, Senator Pappas, especially on, especially when you the VBR stuff. I was like, all right, who else wants to get in this? So you got a couple of folks that you want to chat with us, since I don't see anybody else raising their hand to talk to you. So I got 1, 2, 3, 4 people on there. So Diana and Teresa, come on down. Teresa Bates and Diana Taystat. I get that wrong. You're going to just correct me on that, will you please? I ask people to help me pronounce your names, and it's like I just mess it up every time. So, are you Diana?
I'm Diana.
You're Diana. So let's go. Ms. Bates, you want to go first?
Yes, thank you. Good evening. Chair Hoffman and members of the committee, my name is Teresa Bates. I live in Roseville, and I'm a housekeeper at the Estates at Roseville Care Center. I am here on behalf of my union, SEIU Healthcare Minnesota and Iowa. Our union represents about 50,000 healthcare workers around the state. We work in hospitals, clinics, nursing homes, and self-directed home care. We support the Nursing Home Workforce Standards Board. I want to thank you, Chair Hoffman and Ranking Member Abler, for co-authoring this bill. Sorry. I have worked at Roseville for 5 years. Before that, I worked in long-term care in Washington for almost 20. And all my time working, short staffing has never been worse. At my facility, we have 2 housekeepers to do the work of 4. And 2 people have to clean the building for 120 residents. In addition, because we didn't have enough direct care staff, housekeepers have to help residents. We answer call lights. Every day, I had to answer dozens of call lights because there was no other staff. Now I'm lost. Nursing homes are already one of our most dangerous jobs in the country. Working without enough staff makes them even more dangerous for workers. Last year, because we did not have enough people, I worked 23 days straight. Eventually, your body breaks down. Eventually, I tore my bicep tendon and was barely able to lift my arm. I haven't worked light duty since. Injured workers like me make our short staffing problem worse. I have recovered a little bit and can now work in laundry, but I don't know when I will be back to full duty. If we had adequate staff, I would not have gotten hurt. When we hire new staff, we can't keep them because wages are so low. We just hired a woman named April. She loved the job and was really helping, but she just quit to take a job at the post office. They offered her a lot more than the $14.60 an hour she was making at the nursing home. We used to joke about how stressful it was to work at the post office, but now it's a better place to work than a nursing home. I am not a policy expert, but I can tell you what it feels like in a nursing home. We don't get treated with respect. Our managers pay us as little as they can get away with. Right now, I am fighting for a 10% raise that was promised to several of us. If I have to fight for what was promised to me, imagine what it's like for workers who don't have any voice at all. The problem is not just a lack of funding. The business press says lots of people are making money from nursing homes. More of that money should go to all the workers. To get more money for workers, you have to give them the power to set standards. I'm lucky. I have a union. I get a voice. But too many workers don't have that chance. This bill wouldn't give them a union, but it would give them some say. We know there are good people in management. They face many of the same challenges that we do. All we want is a chance to sit down with them and build something that gives our seniors the care they deserve. Please vote yes and support Senate File 1621. Thank you.
Thank you, Ms. Bates. Thank you for your service, and to feel the overwhelming of being two people taking care of lots of folks. Thank you.
Thank you.
Ms. Tasted Damer.
Yes.
Was that close?
Tasted, yes.
Tasted.
You're
Welcome.
correct.
Please state
Yeah.
your name for the record. And
Yeah. Thank you, Chair Hoffman and members of the committee. My name is Diana Tasted-Damer, and I am testifying on behalf of UFCW Local 1189, where I am the Legislative and Political Director. Our union represents over 10,000 workers in Minnesota, Western Wisconsin, and North Dakota, including about 3,000 nursing home workers here in Minnesota, from the Iron Range all the way down to Houston, Minnesota. We signed a letter, which should be in your packet, along with several other nursing home unions, including AFSCME Local 65, UFCW 663, and Steelworkers District 11, to support Senate File 1621. Every day, our members struggle with short staffing, and the challenge has never been worse. They're constantly working short. They see residents with higher and higher acuities. Some of our members are working, in some cases, with 50% agency staff. Residents and other staff don't know if that worker will be there tomorrow, let alone 3 months from now. COVID outbreaks continue and just compound the short staffing crisis that already exists. Simply adding new money to the current system won't produce a systematic change we need to fix the problem. Just because you fund a nursing home does not mean workers get the full benefits. When we are in bargaining, we are constantly getting conflicting information from employers around the reimbursement system, which makes it hard to hold employers accountable to their own workers. As we said in the letter, policy experts on both sides from the political spectrum, from the Progressive Center for American Progress to the Conservative American Compass, have called on legislators to provide new ways for workers to have a collective voice in their industry outside of the narrow limits of federal labor law. That is why last fall, my union was a proud sponsor and helped pass a resolution at the Minnesota AFL-CIO convention in support of labor standards boards. By passing this bill, you can help raise standards for both union and non-union nursing home workers. And by giving workers a voice in their industry, you make sure that taxpayers' dollars are going to good jobs. Thank you.
thank you, and thank you for representing the many members, the United Steelworkers. And I saw, members, there's a couple of letters in your packet that was referenced. You can get those. Toby Pearson, Aaron Hupert. I can't see it. Look at this. I've known you for a few years and I can't even get that right. Jeez. I need to go back to school. Toby Pearson. No. Aaron Hupert. I got that. Mr. Pearson, Ms. Hupert, who's going first? She is. Please state your name. Say it like 18 times so I can not forget it. So thanks, Aaron.
Sure. Mr. Chair, members of the committee, my name is Erin Hupert, here with Leading Age on behalf of the Imperative. And if it helps at all, Mr. Chair, I have other members of my extended family who pronounce it differently as well. So I accept any version of the last name pronunciation.
That makes me feel great.
Yeah.
Other than that, waiting for a bill to be heard in judiciary has got to be even more fun than trying to figure out some other's name. But I just got to slide my little Minnesota passive-aggressive stuff in there. So go ahead. Thank you for being here.
Fair enough. Mr. Chair, members, thank you for the opportunity to testify today. First, I would like to acknowledge that, as Senator Pappas mentioned, since the bill had its first hearing in labor, we have met a number of times with proponents, some of the House staff, and then the House sponsor to try to address our concerns. There has been some progress towards that end, but we do remain opposed at this time. I also think it's important to acknowledge the testimony of Ms. Bates. She is absolutely right that she and her colleagues deserve a wage that supports raising a family and that elevates her profession and her service to seniors in Minnesota. And so you heard a bill a few weeks ago, Senate File 780, that is aimed at doing just that. In terms of our concerns, we can break it into 3 categories and then focus on one of those categories for the purpose of today. So we have some concerns around governance, structure, and duties of the board, which we hope to address before its next committee stop. We have some questions and concerns around duties and training for the certified worker organizations, and then several questions and concerns around payment and finance, which is where we will focus our testimony for today. So the bill, as amended by the A9, is intended to require that any standard that requires funding beyond the November forecast of the preceding year be authorized by the legislature before the standard goes into effect. And unfortunately, the A1 doesn't address 3 critical problems.
You mean the A9?
I'm sorry, the A9.
Okay.
It was the A1 in the other body.
Okay.
So the A9 doesn't address.
Third time it's been mentioned now.
So the A9, relies on a global estimate. So the November forecast in 2022, for example, projected an average 9.4% rate increase for nursing homes. But that's an average. So some nursing homes would receive more and some received less. And the A9 does nothing to ensure that the standards set by the board can be met by all 350 nursing homes and their 350 rates. Second, the forecast used to effectively certify, for lack of a better word, that there are sufficient funds in the forecast relies on 2-year-old costs. It's not a current representation of a nursing home sector's financial picture. It's not a current representation of a nursing home's actual financial state. By extension, the VBR rates produced in January and each year are used to support a nursing home's existing costs. So for most nursing homes, what that means is they can't be tapped to cover new expenses without making a reduction somewhere else in their budget. So they use their 2023 rates to pay for their existing expenses, if that makes sense. Finally, as Senator Pappas stated, the A9 does nothing to address the gap or the lag that exists between the cost report and the rate. What that effectively means is that the bill as amended by the A9 could actually make this gap worse if a nursing home is mandated to spend its current rate, so its 2023 rate in this example, on new standards without a new appropriation, and then they would have to offset that by not paying for something else, like a vendor for therapy or food. And I'll turn it over to Mr. Pearson, who can give 2 specific case examples on how that works in more detail.
Thank you, Ms. Hubert. And Mr. Pearson, to that point, welcome to the committee.
Mr. Chair, members, my name is Toby Pearson, here on behalf of Care Providers of Minnesota with the Long-Term Care Imperative. I'm going to pick up where Ms. Hubert left off with 2 scenarios that we think help emphasize the point we're trying to make. You have to start with the fact that all skilled nursing facility rates have been audited, their allowable costs, and they've been run past DHS for what your rates ultimately end up at. There's no monkey business. Believe me, Kim would come down on you hard if you tried to get something past her with the allowable auditing costs. In a scenario for a typical nursing facility, on January 1st, 2023, the operating rate is set at $270, which is an increase of about 8% from the previous year where it was $250. Meanwhile, the actual operating costs on that January 1st of 2023 is $290 because your rates are set at the previous years. So you've had 15 months since the end of that cost in order to now you have to figure out how you're going to make up that gap. Now, under Senate File 1621, as amended by the A1, let's say the Workforce Standards Board was in place and created a standard that increases cost to that nursing home by $20 per resident day. That would theoretically be within the forecasted amount, theoretically, but it's not actual money in the pocket. So, instead, you would have operating costs that are now at $310 per resident day, and your reimbursement is still at $270 per resident day. You are exacerbating the problem where you don't have money in your pocket to fill it. So what would the nursing home do? The nursing home would be forced to comply with the new standards, not use its rate to cover the other operating expenses like food, therapy, or other labor. In essence, you would have to take from your existing, already audited, allowable costs and say, we need to pay for these other things over here. As one example, let's assume that the Workforce Board creates a minimum wage for CNAs at $25 per hour. We could all agree that CNAs should probably be paid close to $25 an hour, if not more. If you rely on the global estimate, you'll be about $13.60 per resident day for nursing homes. However, if you're a nursing home that's been challenged and your starting wage is only $16.50, you would receive $138,000 less than what is needed to get to that standard. Again, you're driving the hole bigger. Furthermore, under the current language, the board must address the very broad category of working conditions for nursing homes. This could include staffing mandates, hourly restrictions, or any number of open-ended topics on the functions of the nursing home, the financial and operational implications of which are not fully addressed in the amendment. Things that we have to deal with in nursing homes that are uncomfortable but need to be dealt with because people need services include forced stays. What do you do when you have one CNA on to cover 20 people and the next person doesn't show up for their job? If this board makes a rule that says you can't do that anymore, what are you supposed to do? The board could also set staffing requirements that a facility may be unable to attain. We've heard how difficult it is to get workers within the facilities. If you set a staffing ratio that you cannot meet, what is the facility to do? All of these things are possible because the voting mechanism within this bill relies on a simple majority. So you have 3 governor appointees, you have 3 union appointees, and you have 3 members that would be provider appointees. If the majority says it has to be that way, it has to be that way. As Ms. Hupert said, we have been regularly meeting with the proponents to resolve these very real concerns. We remain committed and hopeful that when Senate File 1621 comes back to this committee for final action, it includes language that can recognize the site-specific needs of the forecast and limitations and structures of the voting of the board. Thank you.
Thank you, Mr. Pearson and Ms. Hupert. Senator Pappas, so that's going back to the opening statement about, it's a work in progress, right? I mean, you've heard the concerns of the industry, and I know Rick Varco and folks are working. Is there, what are you thinking? I just really encourage that continued conversation to happen, right? I mean, unaware of some of those other things, and it seems to be all circled around this VBR, I mean,
Right.
Oh my God. Maybe, are there other body members that used to be in the other chamber that maybe would have voted for this 20 years ago or 15 years ago? I don't know. Senator Abler.
Well, thank you. And that's funny. Senator Pappas, we just tell jokes there most of the time in the face of some of the most grisly, challenging situations anywhere with people with disabilities and seniors and challenges and workforce and people who can't get their family into a nursing home, maybe 50 miles away if you're lucky sometimes. So, Mr. Chair, why would I co-author a bill like this? because I think the dialogue needs to happen, and I think something does need to happen.
Yep.
And we got an award the same day from some of these same people. I think maybe they want my award back, but they're not getting it because I still care. But we are committed to this. So, Mr. Chair, I took a couple notes while they were talking. So, am I allowed to hold up this thing? There's two numbers on this paper. One is $4.6 billion.
There's a former Senate president, who's, presenting her bill. I don't know. Is it allowable?
Oh, no, you're the chair. Anyway, but this is the number
Okay.
a certain governor from the state of Minnesota put forward, a $4.6 billion budget just this year. That's the top number. And the bottom number was how much is in there for nursing homes. 0.
Okay.
And one highlight, Senator Pappas, and that's not kidding, like what? Not one new penny. And we've struggled with that. As you recall, we passed a $1 billion bill last year in the face of a similarly small number. If we could have got that passed, this would be a better conversation today. But and so part of my goal is to just keep reminding whoever is across the street over there that decides these very small numbers that that's not a good number. An advantage of this bill that I see, and it needs to be worked through, and which is why I offered to help you and others to sort it out, is that maybe they will notice. Because there is a problem with a 19-month lag or whatever. So so in the budget, here's the money, but the money's not going to come for 19 months, and you can't very well pay that, and you have to cut food or something. And I think the Department of Health to say we're required to provide food. None of the bills you passed today said we don't have to provide food anymore. So we have to still provide food and heat and water and whatever you have to provide, and it's a real challenge. But Mr. Chair and members and to the public that's watching, this committee and this body has cared over and over and over again, no matter who's in charge. And I believe the targets that come out finally, whenever you get those scored away from the Senate, are going to reflect a very strong interest in getting that number to be far beyond a 0. I pray that the other body will respond in kind, but that leadership, Mr. Chair, has to come from the top. And it is not. And I'm not a very partisan person, but it's just simply when somebody who's of any party doesn't do something, they need to be told to do it. And the advantage, if this bill goes forward today, and it's not quite ready for that yet, but at least there'd be a number that somebody has to find to pay to cover the needs to keep these dear people working. And, Mr. Chair, my observation has been the individuals, and I'm sorry, I forgot the name of that great testifier who was the woman. What was her name?
Teresa Bates.
Yeah, Miss Bates.
Yep.
And people like her, you are iconic, not just in terms of being so amazing yourself, but in that you are. But of the people that want to serve in this industry, if only they could afford to work there, if only they could raise their family, if only they could stay, they actually would retain. They would stay, and even for lower pay than they might get somewhere else, but they love the clients, they love the work, and they have a passion to serve, and we are not letting them do that. And so I remain committed to try to make this work, and I don't know all the answers, but, and also the issue about capacity and what one person can do. Elder Voices has talked about this with regard to assisted livings. The nursing homes are much more constrained in what they have to do.
Correct.
But even so, people think that their mom or grandma's going to go into a place and they're going to be cared for. The light's going to go off and they're going to get timely service. It is not for any lack of desire or interest on the part of the operators that they can't find people to answer the light.
Right.
And you, Mr. Chair, have taken over an enormous task of trying to fund these people. So when the light goes on, somebody will get served. That message, Mr. Chair, needs to spread not just from this room, but to across the street. And this bill, if it's implemented in some way where there's a recommended number, will actually accomplish that. So that's the best I got for today. But I remain committed to making sure the industry stays open while the workers are able to stay working. And so, Senator Pappas, thank you for leading. I'm absolutely with you on this. Thank you, Mr. Chair.
Senator Rasmussen.
Thank you, Mr. Chair, and appreciate the conversation on this today. And I think Mr. Chair and Senator Pappas and Lead Abler, I think everyone in this committee wants to see an increase in compensation for the workers in the nursing home industry. And the real question is, what's the best way to do that as this committee puts together our work and looks at our budget?
Yeah.
One of the concerns that I have is when I talk to the long-term care providers in the area that I represent, they virtually all tell me that they're running on cash reserves, that they are losing money and that they're going through the checking account, going through the cash reserves. And so I worry about setting up an infrastructure that is going to lead to more regulations and likely more costs for them, especially given the lag and some of the considerations that we heard from the nursing home associations today. I also have a concern that this board will effectively operate as a mini legislature over this, these types of standards, whether it's setting a minimum wage, setting other benefits, that really we're kind of outsourcing our work as a legislature to this board, which is 100% appointed by the executive branch. And I think as a legislature, we should be guarding those responsibilities that we have, because we do the work in a committee like this to hear from the various stakeholders and to shape that policy on behalf of Minnesotans. And I also think it is frankly disrespectful to the collective bargaining process. I support the collective bargaining and having employers and employees come to the table and figure out what works best for them and to be able to come up with an agreement. And this will effectively outsource a lot of this to this board, again, appointed 100% by the governor. I did have one question, Mr. Chair, for the bill author. The bill talks about trainings and curriculum to be developed by the board and to having, it sounds like labor organizations provide this training. Could the bill author talk about what would be included in these trainings potentially?
Senator Rasmussen, absolutely. Senator Pappas.
Thank you, Mr. Chairman. That's really determined by the board, but it could be that labor unions provide the training, but it also could be the Labor Education Center at the U of M, or it could be an employer organization. They could all be certified to provide the training.
Senator Rasmussen. So I would assume Senator Pappas, like STAR, does all this training for people in 245D. It would fit underneath some in that bucket, perhaps, correct? All right. Senator Rasmussen.
Thank you, Mr. Chair. And again, I just don't know exactly. We know that long-term care has a lot of regulations, has a lot of training requirements and different standards that individual professionals need to go through. And so I'm also hesitant to be supportive of a bill when we really don't know what this new training requirement will be and what the purpose and goal of it is. But I appreciate the conversation today, and I just would hope that we consider this, as we look at the funding that we'll be able to hopefully provide to the long-term care industry that's greatly needed, as Senator Abler put.
To that point, Senator Rasmussen, I think one of the things I hear is it's going to come back to us. There's commitment from everybody working on this, and I'm absolutely pleased to see the commitment of everybody working on it, because at the end of the day, it should be what's in the best interest of the people that we're serving, right? And I love it, just ideas coming in, and so I think it will send it to state, local government. I think it's going to come back to us somehow. Isn't it going to come back to us, Senator Pappas? This bill.
Madam Chair, Mr. Chairman, I apologize. I know it has to go to state government and judiciary, but I don't know the trajectory. Maybe Mr. Parker knows about why it would come back here.
So
maybe for funding. If the board, there's a fiscal note, so that's maybe why it comes back here to determine the funding.
Yeah, I think so. Maybe we can get there, but you just mentioned two other stops in there, and I just am going with the commitment. I'm trying to get to the point is if there are still some low-hanging fruit that isn't being addressed that we're talking about here, we should have the ability to bring it back here. I mean, this is where stuff gets worked out is in this committee on that stuff. So, and then to that point, Senator Rasmussen, and then so Senator Utke, go ahead. I'm sorry. I didn't mean to jump on your wagon there, but I just wanted to make sure that if it doesn't fit it, then we should absolutely bring it back here and have the conversation. Does that make sense to you?
Thank you, Mr. Chair. I appreciate your commitment to getting this right and to working with stakeholders on it, so thank you.
Oh, absolutely. And to that point, Senator Rasmussen, I mean, you got Senator Abler, who forgets more in a day than any of us will know about how this stuff came to be, and I'm glad to hear him say to Senator Pappas, let's work this through, and you're hearing everybody involved with this conversation are actually having conversations. to me, that's absolute progress. So Senator Ecke?
And Mr. Chairman, I think I misspoke. The funding is really for labor and industry.
Okay.
And I'm just looking at, though, who funds the board. So it could be jointly.
Yeah.
Okay.
All right.
So Senator Ecke, as long as Senator Pappas and I were having this conversation, did you want to, Senator Ecke, sorry.
Okay. Thank you, Mr. Chair. And I'm hearing that this is a work in progress, and I think it really does need to come back here because it does have a lot of funding that affects us, and we need to know what that is. But in general, I don't see anything in front of me, particularly in this bill, that I wouldn't like to see just go away. We've got two big things, and you expected me to come from that angle.
Absolutely.
But,
That's, you are the guy on here to talk about rates, FTEs, and mandates. And so absolutely, I appreciate you for
We're
that,
talking
Senator
about
Ecke. You know that.
Long-term care funding is number one. We know that's a huge issue. So I would like to see the emphasis of this go to funding. We've got the VBR, value-based reimbursement. That's also a big issue. If we looked at just the funding and the reimbursement process, I'm hearing from a lot of operators, providers, that would be huge. And that would be accomplishing something that we really could do. I see this Workforce Standards Board, I've heard it, was commented on as staffing interference earlier. This is just going the other way as far as I'm concerned. Our operators know how to operate. The last 3 years, they've been put through total hell with a workforce shortage and everything else, which is 100% out of their control. They have no ability to change that. If somebody doesn't show up for work, hey, you got to cover those shifts. You have no choice. This is all about getting the funding up to the point where they can increase their rates to be competitive, because we know what the cost of labor has done over the last couple of years. So back to that, I think we really need to have an emphasis on the funding. What will it take so that they can afford to hire, to keep their places staffed, and actually grow that staffing, because we know they're sitting there with vacant beds that would also improve their bottom line, but they can't get the staffing to fill the beds. There's people waiting for their services. So it's like a lot of bills we've talked about last year and this year, all related to this. If we can stay focused, hopefully we can get something across the finish line.
I appreciate that,
Mr.
Senator
Chairman.
Ecke. Senator Pappas?
Just to clarify, yes, this would be in the HHS omnibus budget, the board. And I think the effort, I think we're all aiming in the same direction, is that we want to make sure that our nursing homes can offer competitive wages so that we have good staff and sufficient staff to take care of grandma and grandpa. And I think that the way this works is that if there's any new standards or requirements that exceed the forecast, then the money, it has to be appropriated by the legislature in order for them to take effect. So that's what we're trying to get at, and I think maybe if we need to massage the language to make sure we're all on the same page with that, we will continue to do that in the next two committees, and then we will be back here.
Sounds good.
To be part of your budget, so if you're so willing.
To that, yeah, absolutely. To that point, Senator Ecke, then we go to Senator Abler and then Senator McQuaid. And Senator Pappas, I appreciate this conversation because this is, welcome to Human Services. This is good. Unlike Judiciary where we, Senator Ecke, to that point.
You could go with her.
Thank you, Mr.
Decline
Chair.
responsibility for last Friday.
Thank you, Mr. Chair. And for you and Senator Pappas, I heard again the fact this funding going through the Department of Labor. I mean, we fund nursing homes. The Department of Labor is getting involved with this Workforce Standards Board. The money wouldn't go through them. And for clarity, I think we have to bring it back. This is the area that funds those things. This is a board set up to, offer the various things that they've proposed in here. But I think, to me, there's no doubt about it where the funding comes and goes from.
Good, thank you, Senator Ecke. To that point, we'll get clarification on that as it works its way around, and then we'll be visiting this again. Senator McQuaid. Notice they said Senator McQuaid.
Yeah. Thank you for keeping my promotion intact, Mr. Chair. And Senator Pappas, I mean, I think this has been a really great discussion, and I think one of the things that can be useful about boards is oftentimes what it actually costs to do something can be lost on the legislature. What it actually costs to support nursing homes, to pay their staff, to pay for the care, can sometimes, we can talk about it, we can mirror the problem, but I think having a board that is looking at this and looking at this alone, that's their duty, their goal, getting that number back and seeing that, what do we actually need to do? I think that could be really useful for us. And so, we, in every committee I'm on, we talk about the workforce shortage, and we have to acknowledge that part of the reason we have a workforce shortage is because we have a shortage of people. There are more people who are retired and out of the workforce than there are that are able to be in it, and that's just the reality. And there are some professions where we can do without. We can add tech to it. We can streamline processes. And then there's some like human industries where you can't do tech for that. You can't have an AI teach a child, and you can't have AI, nurse a sick person. And so I think this is one of the places where when we talk about a workforce shortage, we know that it's because of conditions of work, and it's because of pay, because people are really dedicated to doing this kind of work, but if they don't make enough to do it, they can't continue to do it. And so I think this is going to be a really big piece of the solution coming out of this legislature, and I want to thank you for bringing it forward.
Senator Abler, I agree. Thank you for
thanks,
that.
and just, this is a good discussion. I think, and so I believe in the need for something like this. But I also you don't want to harm the host while you're doing it. And I think we have made that point pretty clear. I just have one question, and then it maybe ask another question. But so
Senator Abler.
But under the rulemaking under 14.389, is that regular rulemaking? I hope it's not expedited rulemaking. Does anybody know that answer?
Senator, say that again, Senator?
On line 5.32 and line 8.5, it talks about rulemaking in section 14.389.
I think if it's, Mr. Chairman, if it's expedited, it has to say that.
All right, well, it doesn't matter for now, but just, I think that if whatever rulemaking they need to do should just be the ordinary method where it's a give and take process. And
Senator Abler.
And one thing else, Mr. Chair, and to the author and to the proponents, you have I don't know how many examples in state government where a board appointed by 3 people from the industry and 3 workers and 3 commissioners gets to write rules. So I think you maybe want to sort out who has the authority to, if you even want rules, and rules can be very dangerous. And so it may well be that we want those to be recommendations to the legislature or something. Otherwise, rules can, well, you and I have sat through many rule discussions, Senator, not Senator Pappas, not you and I, but as we watched rules go forward that people liked or didn't like, expedited or otherwise. So just a thought as this goes forward. So thank you.
I think Senator Abler, to that point, section 14.389 is the expedited rule process in Minnesota. Okay. Yeah. So,
Mr. Chair, I think this is not a good place to have expedited rulemaking by a board. And so so just as it goes forward, I would think that state government would catch that. But
it sounds like I think this is good. You have the commitment from members of this body, Senator Pappas. I'm a co-author on this bill too. I think it's great to see this thing going through, and you're doing that. So I'm wondering, we don't know. We know that there's some labor decisions, there's some money in there, and then there's some other things that need to be worked out. So, we don't know. Eventually, it'll come back. I don't know if it's going to come back to us in the form or where it's going, but I think it does need to come back to us somehow, just to have that conversation at the end. Is that fair? Well, I do want it to come back here because I like this bill. I like this conversation. It's going in the right direction, right? And to hear people are talking. So I'm wondering, does it make sense for this committee to pass this as amended without recommendation, therefore to the next stop, and then it has to maybe get it to come back to us? Does that make sense to you guys at this table? Are you okay with that, Senator Pappas?
Yes.
Yeah, I think so. I think we're good. So I'm going to, Senator, who wants to make a motion? No, Senator May Quaid moves that Senate file 1692 as amended.
1621.
1621. Why did I have this in front of me? that was the old one, 1621. All right, let me do this again. Senator Mayquade moves that Senate File 1621 as amended be passed without recommendation to state and local government. Did I get that right, Senator Pappas?
That's correct. Thank you, Mr. Chairman.
Senator Mayquade, is that your amendment? Awesome. Motion, your motion. Here I am. I can't get the amendment motion. I'm glad you're there to clarify that. All those in favor say aye. Aye. Opposed, same sign. Motion does there. Congratulations. Thank you, Senator Pappas.
Thank you, Mr. Chairman and members.
Thank you. Thank you for hanging in there with us and having this discussion. It's absolutely a much-needed discussion, and I appreciate
Great
the work you're
questions
doing.
were asked, so.
Thank you. Members, Wednesday, we have 20 bills in front of us on Wednesday. So I love the look Udke just gave me, by the way. If you guys would have seen that one, it'd be like, we just have a few bills up on Wednesday, and there's some work going on, but I think, and then there's some discussion about some policy stuff that's moving in the other body, policy stuff that's sitting in Senator Wickland's committee that somehow touches our committee. There's conversation we're going to have about what we're doing with that. But Wednesday is just going to be real simply a few bills, and that should do it. Members, anything else? Not? Thanks for hanging in there, everybody. We are adjourned. I need some bumper music.